Hello, my name is Karla Santos and I'm here to present my topic, which is cancer bursting nanobubbles. But before that, I'd like to introduce quadruputics first. The common problem with cancer treatment available now is the ability of the carcinoma to become resistant to chemotherapy drugs and chemoradiation. Another problem with these treatments is also their lack of selectivity since they kill both cancer cells and healthy cells. Quadruputics is a cancer treatment technology developed by Dmitry Lapotko of Rice University which aimed to solve these problems by bringing chemotherapy and chemoradiation treatments to a single cell level. This technology improves the efficacy of chemotherapy and chemoradiation on drug-resistant and radiation-resistant cancer cells. Quadruputics, as the name implies, is composed of four different components: the drug, the laser pulse, the cold nanoparticles, and the X-ray radiation. The first component is a very low dose of chemotherapy drug, doxorubicin, used in the study that is introduced first. The drug is encapsulated and tagged with antibodies so that it will be selective and will target only the cancer cells. The second component is the colloidal gold nanoparticles, which are also tagged with antibodies. Once the GNPs bind to the cancer cells, they get swallowed by the cell. These GNPs do nothing until they are activated with a laser pulse, which is the third component. The laser pulse causes the electrodes in the gold to become excited, thus producing heat, producing plasmonic nanobubbles. Plasmonic nanobubbles are tiny, nanoscale explosions produced by the heat from the GNPs due to the evaporating liquid in the cell. The plasmonic nanobubbles create a small explosion inside the cells which rip the cancer cells open, dispersing the encapsulated drug in the cell cytoplasm which allows it to kill the cell. The fourth component of quadruputics is a small intensity chemoradiation which are amplified by the GNPs inside the cells, allowing for the sure destruction of the cell. Here is an image of an erupting cancer cell due to the plasmonic nanobubble. All surrounding cells are safe, but the cancer cell is destroyed. But what is this all for? Chemotherapy, chemoradiation, and surgery are the most common treatments usually undertaken by cancer patients, but these have a lot of complications. First, chemotherapy and chemoradiation are not selective. They kill both cancer cells and healthy cells, which makes sick patients even sicker. Second, surgery removes tumors, but at the risk of the surrounding tissue which might get affected when the carcinoma is taken out. Plus, there are kinds of cancer wherein surgery is very risky, like brain, lung, prostate, etc. Third, chemotherapy and chemoradiation are long-term treatments, and with this, carcinoma develops resistance to the drug and radiation, which renders it useless. Quadruputics is a novel technique which solves these problems as it provides for a more selective eradication of the cancer cells as compared to chemotherapy and chemoradiation, since the GNPs are tagged with antibodies which help them specifically target the cancer cells and leave the healthy cells alone. Quadruputics is also a faster treatment compared to chemotherapy and chemoradiation and also uses significantly less dosage of drugs and radiation. 3% of the typical drug dosage and 6% of the typical radiation intensity with 1 week of treatment were used in the study, so it's very effective. Because the drugs and radiation's effects in the cell are amplified by the GN. The central idea of this entire thing is actually the utilization of the plasmonic nanobubbles to kill the cell from inside, which makes it very effective against cancer. However, the nanobubbles are not only for cancer. A patent search revealed that this technique is used in many different ways to deliver certain things in specific cells or as a way to kill only specific cells. This patent shown here is about a way to treat malaria using this technology by utilizing nanobubbles to destroy infected red blood cells by destroying the parasite and the hemozoin nanocrystal produced by the parasite which causes the infection of the RBC. They use the same concept of applying laser pulses to produce plasmonic nanobubbles from the nanocrystal in the infected cells, which causes the destruction of the cell along with the hemozoin nanocrystal, which eliminates malarial infection. So why is this relevant? Well, cancer is actually the third leading cause of death in the Philippines after communicable diseases and cardiovascular diseases. This is because in the Philippines, the cancer patients usually discover their diseases already in the late stages, which make it very hard for the disease to be treated, since the thing with cancer is that early detection could increase the survival rate. This is why cancer has such a depressing survival rate of 30-40% depending on the type in the Philippines. And even with the proper treatment, a lot of people still die. Another problem is also the ability of the carcinoma to develop resistivity to the treatment available. And there's also the high rate of incidence of childhood cancer in the Philippines. So this is a problem because for children, since they are more delicate than adults, they cannot undergo surgery for the removal of the carcinoma. And so chemotherapy and radiation are the only options open to them. So with the development of quadruputics, it could solve these problems since it's relatively child-friendly and very safe for children since all they have to do is to ingest the gold nanoparticles which are biocompatible and not toxic.